Well, good morning, everyone. Thank you for joining us and welcome. My name is Krista Barron. I'm the Executive Director of PATHS. I am new to my role. I've been with the PATHS team for just over 2 months. Previous to PATHS, I was an Executive Director of a second stage shelter here in Regina, where I'm joining you today. PATHS is the provincial member association representing organizations across Saskatchewan that support individuals and families impacted by intimate partner violence. Founded in 1984, PATHS works alongside its members to strengthen services, advance research, provide education and advocacy, and support a shared vision of a society free from violence. I'd also like to just pause very briefly and then provide a land acknowledgement as I join you all from Treaty 4 territory. PATHS and our member agencies support individuals living on Treaty 2, 4, 5, 6, 8, and 10 territories, the traditional lands of the Nehiyawak, Anishinaabe, Dene, Dakota, Lakota, Nakota, and the homeland of the Métis Michif Nations. We recognize the historical and ongoing harms caused by colonization and are committed to moving forward in the spirit of reconciliation. So to get things going today, I'd like to give an overview of the project in today's webinar, along with a few relevant definitions. Between 2019 and 2021, PATHS collaborated with representatives of relevant provincial government ministries to improve the legal system response to victims and survivors of intimate partner violence and abuse. One recommendation that came from this project was to adopt a common risk assessment tool for use across systems in Saskatchewan. Then in 2024, under the National Action Plan to End Gender-Based Violence, which is a federal and provincial partnership, the province of Saskatchewan, through the Ministry of Justice and Attorney General, Community Safety and Wellbeing Branch, issued a call for proposals to develop a common assessment tool. PATHS and project partners Family Service Regina and Family Services Saskatoon were the successful proponents. This project resulted in the Saskatchewan Common Assessment Protocol for Intimate Partner Violence and Abuse, which you'll probably hear more simply referred to as the SaskCap. So for today, we wanted to overview a couple definitions that you're going to hear throughout the webinar. The ones that we have that are key include screening, which refers to asking individuals structured questions to identify whether they are experiencing or have experienced violence or abuse from an intimate partner, or whether they are using violence or abuse against their intimate partner. We also have both generalist services and specialist IPVA services that we refer to throughout the webinar. Generalist services support clients experiencing a variety of needs beyond IPVA. Some examples of these might include police, medical or healthcare, mental health, counseling agencies, addiction services, child protection, education, financial assistance, disability services, and legal services. Specialist IPVA services are domestic violence shelters. So, for example, women's shelters, transition houses, interval houses, safe shelters, as well as IPVA counseling and outreach programs that provide specialist support to victims and survivors. Specialist IPVA abuse intervention and treatment programs provide specialist support to people using IPVA. While services such as police are generalist services, there are professionals with IPVA specialist roles within policing and other generalist services. Last, we use intimate partner violence and abuse to refer to physical, psychological, emotional, verbal, economic, sexual, and spiritual abuse, as well as excessive jealousy and control, harassment after separation, and murder. And as previously mentioned, we use the acronym SaskCap to refer to the Saskatchewan Common Assessment Protocol for Intimate Partner Violence and Abuse. So today's webinar is going to provide an overview of the SaskCap. the content, and the accompanying online tool and training module. We expect the presentation to last approximately 1 hour, after which time we will have questions. We do want to remind participants to please put their questions in the Q&A box, which is located at the bottom of your screen throughout this webinar. And following the presentation, we will direct these to presenters. We also would like to note that this webinar is being recorded and it will be available on PATH's online training platform following today's presentation. And finally, I'd like to introduce you all to today's presenters. Starting off with Dr. Crystal Giesbrecht, who is PATH's Director of Research. Hi, Crystal. We also have Jess Hoover, who is PATH's Digital Learning Specialist. Hi, Jess. Jen Renwick, the Director of Gender-Based Violence Prevention Services at Family Service Regina. And last but certainly not least, we have Myrna Canagan, Director of Programs at Family Service Saskatoon. Thank you all, and I'll turn things over to Crystal to start today's presentation.
The development of the Saskatchewan Common Assessment Protocol for Intimate Partner Violence and Abuse, the SASCAP, was informed by consultation with survivors and professionals who work with people who experience or use intimate partner violence and abuse. The consultation began with a survey that gathered responses from professionals regarding existing screening, risk assessment, and safety planning tools and practices in use in Saskatchewan. We held 2 in-person consultations with additional consultations facilitated on Zoom. In total, 69 professionals participated in these consultation sessions. Sectors that participated in the consultation sessions are listed here. These included domestic violence shelters and services, sexual violence services, victim services, police, legal professionals, and several provincial government ministries, among others. Input from these consultations informed the development of the SASCAP. The draft SASCAP was shared via email with everyone who participated in the consultations, as well as many others who were invited to provide feedback. Representatives from domestic violence shelters and counseling centers in Saskatchewan provided feedback on the draft SASCAP at a PATH's Advisory Council meeting. 8 survivors reviewed the draft SASCAP or completed the Risk Indicator Checklist, the RIC, with an IPVA professional. Revisions were made based on the feedback that we received. Following this, the online version of the RIC and the Saskatchewan Safety Planning Guide was developed. The SASCAP, the online tool, and the accompanying online training module were shared with agencies that volunteered to pilot them 1 month prior to the public launch. The SASCAP includes backgrounders, practice tools, and practice guides to assist service providers in identifying people who are using or experiencing violence, evaluating risk, and supporting victims and survivors in planning for safety. Topics include coercive control, domestic violence-informed practice, the Safe and Together model, relevant legislation, and several others to build a shared understanding of intimate partner violence and abuse and ensure the use of common language. The practice tools include screening questions for victims and individuals using violence, the risk indicator checklist, child exposure indicators, guidance for determining the primary aggressor, the safety planning guide, and another fillable safety strategies tool for survivors, as well as a resource list of specialist supports for survivors of IPVA available in the province. The practice guides provide direction for using the tools, including screening, completing and interpreting the RIC, reporting to Child Protection Services, and engaging in structured safety planning. These include some preambles and additional information to help guide the conversation when using the practice tools. The goal is consistency and survivor-centered decision-making across sectors. All of the resources are available at sascap.ca. On this page, you will find the complete PDF document and separate documents for all of the backgrounders, practice tools, and practice guides, the online risk indicator checklist, and Saskatchewan safety planning tool, and the online training module that accompanies the SASCAP. Now I will pass it to Jess to describe the SASCAP process and provide a preview of the online training module.
Jess, you're just muted.
Thank you so much. I'm going to show you a quick run through about how this works through the online training module. So as Crystal mentioned, there are 3 parts to it. This is a little sneak preview of the training. So on the sascap.ca, we have that lovely resource page I was just showing you while Crystal was talking. We also have the online version of the tools, the risk indicator checklist, and the Saskatchewan safety planning guide, as well as the online training. So with the online training, here's a sneak peek. There's background information about intimate partner violence and abuse, its prevalence in Saskatchewan, all of the terms, acronyms, and definitions that we like to use in this sector, how to recognize signs of IPVA. There are scenarios, videos, and a whole lot more. The idea for the training is that anyone who has never worked in this field could take it, a new hire, and just have a pretty good sense of how to use the SASCAP. So as we keep going, this shows how we break down the SASCAP process. So we want to recognize when people are experiencing abuse with screening, determine the risk level, and ultimately create some strategies for safety. So if you follow the flow chart here, the goal of the SASCAP would be universal screening across Saskatchewan in all generalist services to clients of all genders. After you complete the screening, you can see there are 3 pathways. The person does not disclose and there are no indicators of abuse. So you can share resources in case they ever need them in the future and send them on their way. The other 2 pathways are a client discloses abuse or they do not disclose, but there are indicators that abuse might be present. So for example, a client says they're fine when you ask them the screening questions, but you notice that they have some fingerprint bruising on their wrist. In both of these cases, the next step is the same. We're going to address immediate safety needs, provide resources about intimate partner violence and abuse, and referrals. The next step is assessing risk. So this is where the risk indicator checklist, or the RIC for short, comes into play. And if you are comfortable going through the RIC with a client, you can do so or refer on to an intimate partner violence and abuse professional. Going through the RIC will determine a person's risk level, and after that, the next step is always safety planning. So I'm just going to show you here, jumping back into the PowerPoint, are 2 screening questions. So originally we had thought of several more screening questions, but ultimately decided that if people are answering yes to the question, have you ever been afraid of your partner or dreaded what they may say or do, and no to will you feel safe when you leave here today, either one of those questions is enough to screen in for intimate partner violence and abuse. So I'm going to just jump back to the training module here. I'll show you a little bit more about screening. The first section here has how to recognize signs of IPVA. It's not always visual indicators. Sometimes it might be symptoms or behaviors from the client, or even behaviors from their partner that you notice. So lots of information there. In the next section, we have some information from our practice guide for generalists. Since generalists are often going to be new to the topic, there's extra information on how the screening process can look. And there's no expectation for generalists to become experts on the issue. All you need to do is ask those 2 questions, and if you have concerns, share the information so they can choose to seek further support if they feel ready to do so. So we have some information about what to say before asking the questions, a little blurb about how you could bring it up and how to respond. Again, we're going to go back to the flow chart and just, we have video scenarios showing each pathway for the flowchart. So you can see how those conversations could look in practice. So in this scenario, you can see that the client has a black eye, but she does not disclose any abuse. And if you watch the video, you can see how the service provider responds to that and addresses the black eye. After screening, we have a section here about how to refer, and you can see here that sharing information can be as simple as this PDF we have of tool number 8 with all the information about shelters and services in Saskatchewan. After screening and referrals are made, the next step is risk assessment. So I'm going to pass things back to Crystal to talk more about the development of the risk indicator checklist.
The risk indicator checklist in the SASCAP is largely based on risk factors detailed in the Saskatchewan Domestic Violence Death Review's Case Review Risk Assessment Matrix. We compared the DVDR risk factors to those listed in multiple IPV risk assessments in frameworks similar to ours created in Australia, reports from other Canadian jurisdictions, and the risk factors on the police risk checklists used in Saskatchewan. The result is the RIC, which contains factors relating to the immediate situation, violence and abuse in the relationship factors, the perpetrator's history of violence and lifestyle factors, the perpetrator's attitude, substance use, and mental health, as well as the risk to children posed by the perpetrator and barriers to support and safety planning considerations for the person at risk. The RIC is not an actuarial risk assessment like the ODARA. It is a list of factors that indicate risk of IPVA as well as lethality. Here we can see a portion of a chart. This was some of the background research that went into creating the RIC, comparing the risk factors found in the Saskatchewan DVDR, risk assessments, frameworks, and checklists. For example, risk factor 9 in the RIC is, does your partner or ex-partner constantly text, call, contact, follow, stalk, or harass you? Do they seem obsessive or preoccupied with you and what you are doing? That corresponds with DVDR risk factor 15, repetitive harassment, preoccupation, or obsessive behavior displayed by the perpetrator. And a variation of this item is also found in risk assessments, including the danger assessment. Police risk checklists used in Saskatchewan also make note of intimate partner stalking. Although the RIC is not a validated risk assessment tool, risk factors included in the RIC are backed by evidence and demonstrated by research and DVDRs to be linked to risk of future violence and lethality. The references for all of the risk factors included in the RIC are listed in Practice Guide 3. The number of indicators of risk to the victim posed by the perpetrator corresponds to the level of risk. Given that prior to completing the RIC, individuals will have responded to one or both of the 2 screening questions indicating that there is a potential risk, the RIC does not include a category of low or no risk. Someone would be considered at risk if they have up to 7 risk indicators present, but none of the high risk factors. We chose this threshold because in 364 cases of domestic homicide reviewed in Ontario from 2003 to 2019, using a nearly identical list of risk factors to the Saskatchewan DVDR, 7 or more risk factors were identified in 71% of cases. Someone would be considered at elevated risk if they have between 8 and 26 risk factors present and 1 or 2 of the high risk factors. There are 19 high risk factors identified in the RIC. Again, these are informed by the work of the Domestic Violence Death Review and other intimate partner violence and intimate partner femicide risk assessments. Examples of high risk factors include a recent increase in frequency or severity of violence, the victim identifying that they are afraid, violence toward other people, and threats of suicide made by the perpetrator. Serious risk is when 27 or more risk factors or 3 or more of the high risk factors are present. When the person at risk identifies that they have experienced strangulation by their partner, they will automatically be classified as at serious risk. We have similar criteria to determine the level of risk for the separate sections relating to risk to children and victim barriers. The scoring is included in the PDF at the end of Practice Tool 2. When using the online RIC tool, the risk factors will automatically total and the corresponding risk level will be provided. The risk factors included in the RIC connect to the items in Practice Tool 6, Saskatchewan Safety Planning Guide. The goal of this combined tool is not simply to identify the level of risk, but to help survivors of intimate partner violence and abuse and service providers take actions to improve safety. Strategies in the Safety Planning Guide were drafted by the working group with additional input from POWDS member agencies, frontline staff members from domestic violence shelters and counseling centers in Saskatchewan. In addition, we asked professionals who attended the consultation sessions to provide additional information or clarify information regarding specific safety strategies. The Saskatchewan Safety Planning Guide does not suggest specific agencies or services that are only available in one community. We have endeavored to suggest supports and information that are applicable across larger areas of the province. Of course, given the geography of Saskatchewan, access to services differs from north to south and between larger and medium-sized urban centers and rural areas. Identifying individual risk factors on the RIC will offer suggested actions for the survivor to take, actions for the professional to take, or additional information to provide. Potential resources, safety strategies, and considerations have been included to provide victims and survivors with suggestions for risk mitigation strategies related to the identified risk factors. Examples of additional information to provide include family law information when children are involved, information about red flag laws when the perpetrator has access to firearms, or information about pet-friendly domestic violence shelters and animal safekeeping programs when the survivor has animals in their care. It's necessary to tailor each victim or survivor safety plan to their unique situation, including risk factors relating to their partner's behavior, recent changes such as separation, and available resources in the local area. IPVA professionals can provide additional information and assist individuals at risk in revising their safety plan. And now I will pass it back to Jess to walk us through the online version of the RIC.
Thank you, Crystal. So here we're going to start on saskap.ca, and this is our online risk indicator checklist, the RIC. We can access it straight from here. So to start a new risk indicator checklist, we're going to click over here on the left. As you can see, this will auto-generate a confidential ID number. So there's no identifying information attached to you other than this number. We're not collecting any personal data. The only data that we do collect is extremely general, like the number of people who are using the tool. So if you write down the number on a piece of paper or save it on your phone, you can return to a completed or partially completed RIC. If you were a service provider accessing this from a safe computer, you can also use the link that's auto-generated here. So after you begin a new risk indicator checklist, the system will keep your information saved for 90 days. If you print it off and you never need it again, the information will be deleted, and that is the end of that. If you are accessing multiple services and want to share information with someone without retelling the story 5,000 times, if you want to print off a copy or email a PDF of the risk assessment, you can log back on within that 90-day period, and the timer will reset anytime you access it. So if you are keeping it updated with new information, you could keep it active theoretically for years if that's how long you need it for. And if you haven't accessed it in 90 days, we felt that perhaps the situation might have changed enough to warrant being redone. So I'm going to give you a quick walkthrough, show you the different sections of the RIC. It is very extensive, as you've heard about all the research that went into it. So the first page, as you can see here, is just demographic data. This changes some of the questions shown later on in the RIC. For example, if you don't have children, you won't see the section about children. Other things, like if you live rurally, will help inform the safety plan. The first section here is about the immediate situation. It's designed this way so that even if you only have a super short period of time to go through this with a client, it should give you a sense of the major concerns and how to help create like the start of a safety plan. And if you click yes on a question, a little text box is going to pop up. This is where you add comments about the specifics of the situation. So you'll see more how this works coming up later. So the next section we have here is about violence and abuse in the relationship. At the bottom of each section, you'll notice that there is a text box here. This is just open-ended for anything that a client may feel is not captured in the questions that we've asked above. So our next section is the relationship factors. So stuff like, do other people live in your home? Have you been impacted by financial stress? Just the relationship. This section is about the perpetrator's history of violence and lifestyle factors. So while we're here, another thing I'm going to point out is this little question mark. So if you click on this, it will show you some more information. For this question, it links to practice guide number 3, which shows you more about the evidence and the research behind each risk factor. So sometimes a client may ask, like, why is that a risk factor? There's research and evidence. You could always reference it at practice guide number 3. And so for this one, it elaborates on the question. So if you're thinking history of failure to comply with orders, what does that mean? That's vague. This is going to give clarity. So a violation of court orders, different types of orders, and just more information. This can be helpful for survivors or the service providers, just getting that explanation out there. Our next section is about the perpetrator's attitudes, substance use, and mental health. This section is about children. So again, if you indicated that you don't have children on the first page, you will not see this section. And finally, we have barriers to support and safety planning considerations. These questions do directly inform the safety plan. And our final section here is the intimate partner violence and abuse professionals assessment of risk. So for many of the people who have years of experience in this field, it's a place for your high-level overview of the situation. As you can see here, if you're filling the checklist out by yourself, you don't need to do this step. You can skip it. On that note, we do recommend that a survivor and a professional fill this out together, but we recognize that many survivors will be filling this out themselves. There's no barriers or professional credentials needed to access this. We thought that it could provide an opportunity for someone to fill this out before they're ready to access services, to get a sense of the risk level, or maybe in the comfort of their own home, bring it in when they are accessing services and perhaps share things they would be uncomfortable disclosing verbally to a professional. They could bring it in and discuss it with an outreach worker and add to the document together by going back in with that confidential ID number and getting some support for safety planning. So with that, we have walked through the tool, and we're going to give you a short demonstration of how this could work in practice. So I'm going to start over with a partially filled Rick and turn it over to Myrna and Jen.
Okay, so as Jess already explained, the first section includes initial demographics such as relationship status, if there are any children involved, age, ethnicity, and where a person resides. Some of these links to safety strategies in the safety planning guide. For example, if selecting that the survivor has children, the risks to those children will display. If there are no children, the safety plan will not populate this section. Also, as Jess demonstrated, each section includes several questions that help assess risk. To save time, we've already completed most of these, which generated the auto-populated safety plan. So now We'll briefly speak with Myrna about her situation to show how the RIC works in practice. So Myrna, we've just learned a bit about you, your partner, and your situation. This next section tells us about the dynamics of the immediate situation, such as fear, how often the violence happens in your relationship, or concerns about future violence. So, have there been any changes or events recently which cause you to worry about your safety?
Yeah, my husband has been having an affair. He's had a few. I just found out about this last one recently, and I plan to leave.
Okay. The next section of questions relates to the violence or abuse that has occurred in your relationship, including the types of abuse, isolation, or any control that may be going on. So does your partner display sexual jealousy at all?
Oh yeah, he's always getting jealous no matter where I am. He accuses me of looking at people. It's just funny because he accuses me, but he's the one that's always cheating. So yeah, he's so jealous.
Right. And then if we click on the question mark here beside this question, we can see that the tool gives us examples of what this might mean. So I hope you know that is helpful as well.
Mm-hmm.
So next we look at relationship factors, such as the status of your relationship, custody and or access to your children, or any age gap that may exist in your relationship. So specifically for you, Myrna, has your relationship ended, or are you planning to end your relationship?
Well, it's always been so on and off, but this time I do plan, like I've had enough and I'm tired, and I want to leave. I want to get out.
Okay. In this section, this next section, the perpetrator's history and lifestyle factors are considered. So these include previous violence outside of your relationship, access to firearms, or compliance with any court orders that may have ever existed that you're aware of. So does your partner have a history of violence or abuse against any previous partners that you're aware of, Myrna?
Actually, it's funny you say that because I remember quite a few years ago hearing from my friends that he used to really be mean and beat up his ex, and that was the mother of his son. And I've heard that from a few people that he has a violent history, not just with me, but with other people for sure.
Right. Okay. So next, the next RIC section assesses the perpetrator's attitudes, substance abuse, or any mental health struggles that he might have. Does your partner have issues with alcohol or drug use? And does your partner typically use alcohol or drugs before being violent towards you?
Yeah, he likes to go to the bar, drink a lot, get really drunk, and then come home and sort of throw me around. He definitely seems to be more mean when he's drinking. Yeah, I think he's just he really escalates fast and gets all kinds of crazy thoughts in his head. Yeah.
And has your partner made themselves seem like the real victim or portrayed you as the problem to other people, including maybe the police?
Yeah, he says I'm the problem and I like drama and I start the arguments. You know, he trashes me wherever he goes. The police have been called on a couple occasions and he really always puts the blame on me that he's the victim and I'm actually causing all the problems. Yeah.
Right. That must be really hard to navigate. So next we look at risks to children involved in your relationship. So has your partner prevented your children from accessing medical or any mental health care that they may have needed?
Would that like be in school? Because I know that sometimes my kids, well, the teacher called and said they're sort of acting out or they're withdrawn at school, and they thought maybe, do you need some supports? Do you want them to maybe get some counseling? And I brought it up, and he absolutely will refuse. He told them directly he doesn't believe in counseling, and so yeah, I can't even get any help for my kids.
Right. Yeah, that's exactly what that question is intended to look at. So barriers to support for survivors is important to consider when we're assessing risk. And that's what we look at here in this last section.
Okay.
So do you care for any animals, such as like, do you have any pets or companion animals? Do you have livestock on your farm?
Yes, actually, we have lots of cattle. I have to be responsible for making sure the cattle get fed. I have one horse that I love to ride. And of course, he threatens to take my horse, and then of course, just small dogs and cats around the farm. But they're basically all my responsibility.
Okay.
I don't know
And
what
are
I
you
would do if I had to leave them there, and he threatens me about that, but yeah.
right? Oh, I'm sorry, Lorna. Are you financially dependent on your partner?
Yep, 100%. I really enjoyed working, but you know, he sort of laid down the law and said I can't work anymore, and I need to be home looking after the kids and the house and the livestock and everything else. And so I basically have to ask him for everything, and he really monitors all of my spending, and he really doesn't give me any extra money for anything.
Okay. Well, thank you for sharing that information with me today, Myrna. That's an awful lot to talk about all at one time. So I hope that all of the information will help us to make some plans about your future and be helpful in keeping you safe moving forward.
Thanks.
Okay, so that was a quick demonstration of some of the questions in the risk indicator checklist. So once the risk indicator checklist questions are completed, the IPVA Professionals Assessment of Risk section is presented. Survivors completing the RIC themselves are not expected to fill out this section. It is intended for professionals who use it to provide a brief summary and highlight the most significant risk factors and identify priorities for safety planning and information sharing. So typically this section is completed collaboratively with the survivor. However, if it is completed without them present by the professional, it's important to remember that these notes form part of the survivor's record and will be accessible to them in their risk report. So the next page to appear is the summary page. Here you can see that the checklist is complete and the buttons to print the tailored safety planning guide and the risk report are shown. A brief summary of the RIC is also shown on that page. If we choose to print the risk report, a downloadable PDF appears as it heads here. At the top, we see that the risk level is highlighted in pink. It also includes the confidential ID number as well as the date on which the assessment was completed. The IPVA Professionals Assessment is shown, noting the summary that was already completed. It also includes the most significant risk factors. In Myrna's case, some of these included an increasing frequency and severity of the violence, that she is afraid, strangulation has occurred, etc. some of the priorities for safety planning and information sharing in Myrna's case include ensuring she and her children have housing when she leaves, including a pet-friendly shelter or housing, and seeing as how she identified as being financially dependent on her partner, a referral to income assistance is also necessary. You can see there are other suggestions that automatically populated based on her answers in the RIC as well. So as we scroll through the risk report, you'll see the indicators relevant to Myrna's specific situation, along with any notes added to provide context for the specific questions and whether each indicator is considered high risk. So this information is presented for each section of the risk. Following this, the risk indicator summary provides a breakdown of the results. It includes the number of present factors, possible items that could be scored, items marked not applicable, items unavailable, and the total items scored. It also highlights the total number of factors and the number of high-risk factors. So this summary is completed across the three main sections of the RIC, risks posed by the perpetrator, risks to children, and barriers to support and safety planning considerations. Each of these sections is then assigned a risk level. So in Myrna's situation, we can see that based on the scoring, her situation has been deemed to be at serious risk in the indicators of risk to the victim or survivor posed by the perpetrator, at elevated risk with respect to her children, and serious risk as it relates to barriers to support and safety planning. And we can see that there are a total of 10 risk factors. So now Myrna is going to go through the safety planning guide.
Thanks, Jen. So when the RIC is completed using the fillable online tool, as we just saw, it will also produce a pre-filled safety planning guide that includes relevant risk factors. For example, those that responded indicated were present, and corresponding actions for the survivor to take, actions for the professional to take, and any additional information to provide. And you can see that there are some examples there, whether you're calling 911, planning somewhere safe to stay when needed on short notice, assist the client in making a safety plan. And so the PDF version of the completed safety planning guide does include clickable links for more information. You can see maybe it's been brought up that there needs to be an emergency intervention order, or as we can see, there's different links to phone information, vehicle, coercive control toolkit. There's a lot of different links, and they will come up again depending on what the answers are in the RIC. So it's necessary, as mentioned before, for the person at risk to customize their safety plan with the assistance of an IPVA professional based on their situation, their goals and plans, and of course, geographical location. However, the online RIC and safety planning guide does provide information and safety planning suggestions for survivors to consider based on relevant risk factors. So as was discussed a few times, we really need to make sure that we are looking at each client's unique situation, where they're located, and the available resources in their area. Okay. So we are going to go on to just go back to the flow chart. And we're going to talk about a few examples using this flow chart. I'm going to use one that talks about a generalist providing support. So we know that some agencies may screen and then refer, and others may use the full SASCAP. So in this particular example, a massage and wellness clinic provides their general information and consent form to a new client that's in their waiting room. The two screening questions are included in their form. Have you ever been afraid of your partner or dreaded what they may say or do? The client answers no. And the second screening question, will you feel safe when you leave here today? The client says yes. So in this case, the person filling out the form states they do not have any concerns related to the screening questions. They are not afraid and they do feel safe. So in this situation, the massage therapist might bring up, why they have these questions there, and thank them for answering and offer resources, educational materials, and maybe some contact information to a specialist if they ever needed it in the future. These resources can be anything from brochures in the waiting room, web links, phone numbers, anything again that would be unique to the area and the location. So the goal always here is just to ask and to support. So if you look on the flow chart, you'll see it's practice tool number 1 and then practice tool number 8. Ideally, we would hope that we can get a lot of people, whether it's a dentist office, massage, other generalist definitions that were described earlier, whether it be legal, different things like that. We just hope that people will start using the screening questions. So I'm going to hand it to Jen to talk about another couple examples.
Okay, so in the next example, let's imagine a client is meeting with their addictions worker for the first time. The worker notices what appears to be maybe the tail end of a black eye. And using the skills they already have working in the human service field, they work the pre-screening questions. Have you ever been afraid or dreaded what your partner may say or do? And will you feel safe in leaving here today? Into their conversation that they're having in a gentle and non-judgmental way with their client. Although the client may not disclose IPVA directly, the worker does assess that indicators are present. So the addictions worker will want to ensure to address any immediate safety needs, provide relevant information about IPVA, and also how to report to the police, provide some referrals related to any children that are involved, and anything else that may be relevant in their situation. Much of this information can be found in the practice tool 8, the Saskatchewan information and resource list in the SaskCap. So in this scenario, the addictions worker could also choose to complete the RIC if they feel comfortable with their level of knowledge of IPVA, or another option they have is to offer a warm handoff by making a phone call to a specialist service in their community while their survivor is maybe still in their office to ensure that support has been arranged. So another example is when a survivor has been referred to or has independently connected with a specialized service, such as Family Service Regina or Family Service Saskatchewan. In these cases, this situation would already be identified as IPVA, so those additional screening questions are not necessary. Their priority should, of course, be to address those immediate safety needs and provide relevant information and offer appropriate referrals at that time. But following that, completing the RIC and developing a safety plan are important next steps. So there may be times when someone at risk of using violence in their relationship discloses information about their own behaviors to somebody, a generalist or a specialist. The SaskCap offers practice tool 4, screening questions for use of intimate partner violence and abuse to assist in screening for the potential use of violence or abuse. We would want to connect them with supports and services as well. And in some communities, services are available for those at risk of causing harm. As an example, Family Service Regina and Family Service Saskatchewan have a joint project focusing on early intervention and the person at most risk of causing harm. And here, if we can intervene early in those circumstances that we know can lead to violence or abuse, perhaps we can prevent it from happening at all. So we know that IPVA can be messy in determining who is most likely to cause harm. can certainly be difficult in some situations. And so the SASCAP provides guidance on this with Practice Tool 5. It's called Determining the Primary Aggressor, and provides questions such as who makes the rules, or which person fears the other, to help in making this determination. All right, so I'm going to pass it back to Crystal here to finish up.
As we wrap up our presentation and before we move into the question and answer portion, we would like to acknowledge the support that we had in developing the Saskatchewan Common Assessment Protocol for Intimate Partner Violence and Abuse. This work was funded by the Saskatchewan Ministry of Justice and Attorney General, Community Safety and Wellbeing under the National Action Plan to End Gender-Based Violence, distributed by Women and Gender Equality Canada. Thank you to Omni Online for working with us to develop the online version of the RIC. The SASCAP includes information and resources from other sources, including the Saskatchewan Domestic Violence Death Review Report, the Coercive Control Toolbox from the Regroupement des Maisons pour Femmes Victimes de Violence Conjugale, our sister association in Quebec, and frameworks from Northern Territory, Queensland, and Western Australia. These are all referenced in the document. The SASCAP was a collaborative effort led by PATHS in partnership with Family Service Regina and Family Service Saskatoon. The panelists for today's webinar are the SASCAP Working Group. We want to acknowledge Joanne Duzal, who worked on this project until her retirement from PATHS in June 2025. We also acknowledge Brandy Beta, who was part of the working group with Jess, Myrna, Jen, and I throughout the project. We thank the survivors and professionals who participated in the consultation that informed the creation of the SASCAP, as well as the agencies and professionals who piloted it. Thank you to all of you who are currently taking the training and implementing the SASCAP in your practice. We appreciate your work to improve safety and prevent violence in our province. Here at sascap.ca, that is skcap.ca, you will find the online training module, the full SASCAP PDF, as well as separate documents for each of the backgrounders, practice tools, and practice guides, and the online risk indicator checklist, which links to the Saskatchewan Safety Planning Guide. Now I will pass it to Krista to facilitate the discussion.
Well, thank you, Crystal, Jess, Jen, and Myrna for the overview and also the opportunity to view the practical uses of the SASCAP. I just want to remind all the participants that we do have some time now that we've allowed for opportunities to ask our presenters questions about the SASCAP. So if you have things you'd like to know, please put those in the Q&A box, which is located at the bottom of your screen. I am just going to allow about 30 seconds so that if people have questions that they're prepared to ask, we have an opportunity to have those come in. So we'll just pause briefly for that. Okay, well, why don't we start in with a few questions? Please continue sending those along. We'll try to get to as many as we can. We had an initial question actually come through the chat. So something that one of our attendees is wondering is if this is meant to be a shared database across the province, or is it meant to be used standalone for each shelter? And maybe I'll kick things off with Crystal responding to this question.
Absolutely. So this is a shared resource. sascap.ca is hosted and maintained by us at PATHS. So this can be accessed by practitioners in generalist or specialist services. So while you will be using it and you may have a slightly different process and way that you implement the screening questions and the risk indicator checklist and the safety planning in your practice, we have created this tool for use at agencies across the province.
Thanks, Crystal. Jess, Jen, or Myrna, if you have anything to add, feel free. So we had another question come in. This question is asking about generalists receiving the training, and will this be a data collection tool for future program or service planning? And maybe Crystal, you just spoke. So Jess or maybe Jen, if you have an answer to this.
I'll just say the training is available for free to anyone who wants it at saskap.ca. You don't need to log in. We made it extremely simple so that you don't even need to join our online learning platform. You can literally just go to that skcap.ca and access the training from there.
Thanks, Jess.
I will mention the data collection piece briefly, since that was also asked in the same question. So we will have the ability to look at data from the SASCAP in aggregate. So right now people are trying it. Some of you are probably clicking on the online version of the RIC to check it out and see how it goes. But later on, what we will do is pull some high-level data to say the number of people that are accessing it. We may be able to say percentage of respondents who use the RIC who have certain risk factors present, rural, urban, things like that. So we won't be looking at any individual level data, but we will look at aggregate data, and that may be able to inform some policy recommendations or some future training and service as well.
Thanks, Crystal, for that. I just wanted to add, for those of you having difficulty with the Q&A box, sometimes it's not immediately visible with your options at the bottom of your Zoom screen. So you can also check the little More button with the 3 dots, and perhaps that's a feature under there, just if you're struggling to find an area to place your question. There's a question as well. How is the tool being promoted? I think Jess or Crystal, you'd be good to speak to this as well.
Jess, do you want to go ahead?
Yeah, I mean, this webinar is a place to start. It just launched, at the end of March. So it's been 3 weeks that it's been available to the public. We are trying to get it out there through our channels, but it is, if you have suggestions for different ways to promote it, we'd be happy to hear it. We're going to be working on doing more promotions throughout the next year, trying to make sure people know that it exists and that it's a really cool tool that can hopefully help people out across the province. So I gladly appreciate your comments in the chat about how to promote it.
Yeah. And Jess, sorry to keep poking you, but there was also just a question again around taking the training, how that works, and if there's a certificate available at the end.
Currently, we didn't do a certificate. We just kept it very open so that if you were an IPVA professional, you don't necessarily need to go through like, what is intimate partner violence and abuse? You already know, like, as adult learners, we want to respect your time. So the way that the training is designed, it is not a certificate-based course, but if there's interest for that, like, we can certainly create a certificate that goes along with it.
I think I see another question just along the training theme that we're on at the moment, just around being a PATHS member agency to access this resource. And my understanding, again, being new, is no, that this is available widely to all. And that is also why there will be continued work done to promote it widely to all. I don't know if anyone else would like to add to that.
Yes, absolutely. Like, if you are a PATHS member and you would like me to enroll all of your staff at once, like certainly reach out, and that can be an easy way to get your team onboarded. But if you're a generalist or anyone else in the province is curious, you're more than welcome to take the training right on saskap.ca.
Awesome, thanks, Jess. We also had a question here asking about police and RCMP and if they've been engaged through this process at all. And how would this support a client wishing to support? Maybe Jen, are you able to speak to them?
Sure. So yes, police were involved in the consultation sessions that we held, as well as in answering the survey. So they've been a part of the project throughout. And certainly, what was the second part of that question, Krista? I didn't see that one.
Okay.
How does it support?
How would it support a client wishing to report?
So, I mean, it might be difficult for, say, a patrol member who's coming out and responding to something to go through the RIC. As you can see, it's quite extensive. But certainly we would hope that they would have the knowledge to make a referral to the specialist services that exist in their community. So we did have participation from various different municipal agencies as well as RCMP. So they've definitely been a part of the process throughout.
Great. Thanks, Jen. Crystal, we have a question here asking, will there be a move to validate the tool and potentially replace the use of ODARA in Sask? So maybe for some of the attendees, a quick explanation on what ODARA is, but also answering the question.
Yes, so ODARA stands for the Ontario Domestic Assault Risk Assessment. It is the risk assessment tool that is most widely used in this province and elsewhere in Canada. What that tool assesses, or the situations where we use it, is when there is opposite sex partners, so male perpetrator, female victim, or female perpetrator, male victim, situations where there has been physical violence or a credible threat of death with a weapon in hand. This tool has a very large evidence base. It is demonstrated to be reliable and valid, and very, very good at measuring what it's supposed to measure. It's quick, it's concise, lots of good points. However, there are specific situations, as I said, where we use the ODARA. So the SASCAP and the risk factors used in the risk indicator checklist, it's long, it's not concise like the ODARA is, but it provides an opportunity for survivors and for service providers to encompass some of the more broad behaviors and other types of violence and abuse beyond just physical violence. So right now, the ODARA is what is used in domestic violence courts and other contexts in Saskatchewan. We haven't intended to replace that. I think going forward, as we say, we have just launched the SASCAP, and we're very pleased to be sharing it with additional service providers today in this webinar and going forward. I think we will see how this rolls out, and we hope to see it picked up and implemented very broadly and widely by organizations across Saskatchewan. But we created this to be a protocol that would help people to respond to intimate partner violence and abuse in all its forms, not to replace what we currently have, but to add something extra to fill a gap.
Yeah. And maybe, Crystal, I'll keep you on just for a moment here in line with some of the explanation questions. We do have another question around whether this tool is or could potentially replace WSIS. So perhaps touching on what WSIS is, how it works in shelter, and if there's ability to use it in that way.
Yes, another good question for clarification. So WSIS is the Women's Shelter Information System. Provincially funded domestic violence shelters use that system at intake with their clients. This does not replace WSIS. So WSIS is for intake information, case planning information with clients while they're in shelter. What we have here with the risk indicator checklist and connected safety planning guide is really to look at the relevant risk indicators and plan safety strategies. So different goals than WSIS. This does not replace that. It's something additional. However, for those of you who use WSIS in your practice, or you might have HIFIS if you're in housing related sector, or other intake and assessment tools in your agency, there may be overlapping questions, especially on that first page with some of the demographic pieces. If you go to complete the risk indicator checklist with a client, you don't have to ask every question exactly in order if you already have the information. You can say, okay, yes, and we already talked about your children before. We've already been talking about, substance misuse issues. We're going to be talking about some referrals for that. So you can see I'm checking that off, and you can kind of move through those questions more quickly if you already have that information. So that can be a way that you might even pre-fill those pieces and sort of show the client where you are based on the previous conversation.
Thank you, Crystal. And thank you. We do have just a comment around potentially looking into having a certificate option. Maybe potentially that would bring in more generalists. So that's good feedback, and I think we'll note that as we continue this rollout of the SASCAP. I wonder, Jen, or perhaps Myrna, if either of you could speak to the question we have around perpetrators educating themselves and the use of DARVO.
Jen, you want to give that a try?
Well, I can try. I mean, I suppose it's something that we might always need to be considerate of. People, can certainly learn things, and typically they would be doing this to still cause harm and intentionally cause harm. We would need to work with what's in front of us, even if we don't necessarily know what's happening. But if we have access to information that maybe can help us to assess a full picture of what's happening, any history that might exist, we have to be mindful of things, but also work with the person who is in front of us and with the information that we do have. So that is a difficult question, and it's a difficult scenario to maneuver anytime you're working with the stories of what two people bring to the table. So I hope that's a little bit helpful, but
it's good.
And Myrna, maybe could you speak to the tool and use of the tool for people to self-evaluate their relationship? So survivors accessing the tool and working through it themselves.
Yeah, I think as was mentioned in the presentation, we hope that people will be able to access it easily and fill it out, making changes or adaptations as they go through. But I think it would be a really good foundational tool to be able to see everything in front of you, and to go over it with with a fine-tooth comb yourself, but also then to be able to have it with you to take to different appointments or things like that. But yeah, definitely, I think it would give some perspective if people are even curious or wondering if their relationship is unhealthy or unsafe. So yeah, I think it would be a great tool for that.
Thank you, Myrna. I wonder, Crystal, if you could speak to the risk assessment being used for family law proceedings.
It is our hope that the RIC will add something helpful in that context. So, of course, this is a new resource for Saskatchewan. We have just launched it, and practitioners are just beginning to pick this up. But we know already some family law lawyers and mediators are doing screening with their clients, and some are completing the risk indicator checklist with their clients or referring to an IPVA professional service provider to complete the risk indicator checklist with them. So as we create more awareness and understanding of this shared resource in Saskatchewan, we do hope that this would be some additional information that service providers would be able to take into account in family law contexts. So So certainly we hope so. And I think the real goal that the Saskatchewan Ministry of Justice, Community Safety and Wellbeing had in this call for proposals, and certainly our goal in taking this work on, was to create a shared understanding, speak a common language, and have shared resources and tools that we could use across the province in these different systems and among different service providers.
I was just going to add as well to this that mediators as well as family law lawyers were involved throughout the process as well in the consultations and the survey gathering.
Thanks, Jen and Crystal, for responding to that question. We had another question here around some of the questions in the tool, and the question is around, does it ask about other ethnicities? There is a question asking if the individual is Indigenous.
So we really thought about this, the working group and at our consultation, in terms of what demographic information we needed to collect. And where we landed was that we would ask the questions that link to specific safety strategies. So it's relevant to know if clients are Indigenous because they may have access to other options, whether it be housing, transportation funds, other specialized supports, and being able to connect people with culturally relevant and safe services. So that is why it's especially important to recognize if clients are Indigenous and have those options for services available. We have also asked if someone is a newcomer to Canada for similar reasons, because there are specialized supports available and additional support, whether it's in the legal context, family law, immigration support, and culturally specific service providers as well. So that's why that's asked there, is to link to those safety strategies. I will also say, in some larger and more populous provinces, there might be an array of service providers for specific ethnic and cultural groups. Here in Saskatchewan, more likely, especially when we're trying to build a resource that's relevant and applicable no matter where you live in the province, more likely that we're referring to more general services for newcomers versus specific ethnicities. So we felt we didn't need to collect that information here in the risk indicator checklist. That said, if you're a service provider and you're working with a client and that is something that's very relevant to their situation and relevant to things you can connect them to or offer for support, add that in that space for additional information.
Crystal, I think you actually answered 2 questions I had waiting there, so great work. Jen and Myrna, I wonder if you can talk a little bit about what if the perpetrator is abusive to the children as well, and how this process works along with that additional intersection.
Sure. So there are specific tools that speak to that question exactly. Tool number 3, you would find it in the Saskap.ca. All of the information, it goes into more detail about that specifically. Jen, I don't know if you had anything else you wanted to add?
No, I would have just referenced as well the information in the SASCAP and how to go about referring to child protection and engaging child protection and when that's necessary.
Thank you both. Jess, I guess I'll point this question to you. We have one around if it's possible to get a generic test login to explore the tool rather than putting one's own information in for exploration purposes.
Yes, I will say for sure, if you want to just make up a scenario that's not true, you can absolutely do that. Take a look, explore the tool. Like, we encourage everyone to check it out. The more familiar you are and the more comfortable you are, that's great. And if you do come across any resources that are missing or questions or anything that you think needs to be changed, we definitely invite you to let us know, because we can always update it. So yeah, please do explore the tool.
Thanks, Jess. And I guess another question to Jen and Myrna. Could you talk a little about what exists out there that is for people who are using violence?
Sorry, the supports that are available to those who are, yeah.
Yes, for people using violence, yes.
Sure. Well, I mean, I could do another plug for Myrna and Family Service Saskatoon and Family Service Regina's early intervention project. So, following a Ministry of Justice call for proposals to really look at early intervention for families and focusing on those who are at risk of using violence or harm in relationships, we joined together to submit a proposal where we would, because we already work with victims of intimate partner violence very extensively and have for many decades, we thought this was a good segue, I suppose, into the knowledge and providing support to those who might be using harm. And so we really focused on how we can get ahead of things that we know are indicators of violence. You know, there are certainly typical situations that we see, addiction, mental health, significant loss in somebody's life, the economy. We know that food insecurity and housing insecurity can all lead to violence and abuse in relationships. So if we can engage those who are struggling with some or many of these factors, then perhaps we can prevent, you know, the crisis moment from happening at all. And so we have some really deliberate caseworker work that's happening. So, you know, we have people who are engaging people if police have been involved, but also if child protection are involved, or those who are just reaching out because they've heard of the supports or seen the supports on our website. And so trying to get ahead of those things. We also have specific counselors who are available, who are specific to their knowledge with those who could be using harm in their relationships. And also both of our programs run groups for those who have identified themselves as potentially causing harm. So those supports are, again, available in Regina and Saskatoon, although the surrounding areas of those two cities, which covers a little better than half of the province in terms of, you know, the number of people, not necessarily geography, but, you know, we do hope to get as many people as we can coming into those supports. But also there are other supports throughout Saskatchewan that people can access, and hopefully they can do that prior to there being an incident requiring police. If that does happen, of course, we have the 3 domestic violence courts that exist that have perpetrator supports that are connected to them, so that those folks can access the support through the court. And the justice system. But yeah, I'm not sure I could go through a whole list of all of the supports that exist right now, but we do have some of that information in the SASCAP on the website.
Jen. And Jen, you touched on sort of the partnerships in the 2 urban centers, Saskatoon, Regina, surrounding areas. I do see a question here, or comment more around RCMP, and that RCMP are using the risk tool with the perpetrator instead of the victim. I'm not sure if you can speak to what work and what support you've had experience with RCMP.
I maybe Crystal, maybe you know a little bit about this. I'm not we work primarily with Regina Police Service, so I'm a little less familiar with the tools that the RCMP use. So I'm sorry.
Thanks, Jen.
I'll try to answer this question. And so I have heard an example similar to this come up in our current research that I'm working on at PATHS about survivors' experiences with the legal system. But just sort of briefly as background, and we referenced this when we were talking about the different risk tools we use to inform the development of our RIC. RCMP in Saskatchewan use the Violence in Relationships checklist. Municipal police also have their own checklist. But as the person who asked the question said, what if they think the perpetrator is the victim, ask the questions to them, connect them with victim services and other supports, and don't offer those supports to the victim? And as you saw in the example that Jen and Myrna ran through, sometimes calling the police first, calling child protection first, trying to get out in front of it by claiming that they are the one who experienced abuse is something that someone who's using violence will do. So does this protocol get at that? It's probably part of a wider conversation and a broader need for training, but we do have a few things in here that I hope will really help. And one is the resource about determining the primary aggressor. We have actually just shared a resource from our sister organization in Quebec there, as well as some of the resources from Australia. Very, very good questions to ask. And then also we have the screening questions for the use of violence and abuse that Jen and Myrna had referenced previously as well. So I hope if professionals, police and others, review those tools, whether they use them in full and ask the questions or use that to inform their thinking and their practice, that will help. But I think wider implementation of the SASCAP and having more of us and service providers from different sectors using this common language, thinking about these concepts, that's going to help to mitigate some of these challenges. And I think we can think about more cross-sectoral training on intimate partner violence and abuse and on connected forms of intimate partner violence and abuse like coercive control as well, to help improve the understanding and then subsequently responses across sectors.
Thank you, Crystal. And I do see a question here about where the training is being shared and how, kind of going back to that promotion piece. And this is something PATHS is working on and developing some initial plans on how to continue rolling this out. So it's promoted widely across the province, including for rural and remote locations. We've had a few questions come in, Crystal. I'm going to come back to you around the use of the tool and doing so, fictionally or in practice form, and how this impacts the data that PATHS is collecting from the tool. I wonder, can you speak to kind of that broadly, if individuals are wanting to just jump in and practice and see what the tool is all about, if there's an impact, and perhaps Jess as well.
Yes, thanks for clarifying, everyone. We really appreciate your attention to practicing, but also good data collection. So thanks. Most important is that you use the tool, you check it out, you become familiar with it. So that's the number one priority. And when we're not going to go pull data this month or this week and say this many people used it, because we know we're promoting this with the webinar and we want people to be practicing. So we won't look at data until a while down the road. But if you are looking through it at a staff meeting or practicing it on your own, something that would be helpful is in those first couple qualitative text boxes there, when it invites you to put an example. If you check yes to the risk factor, just put test in the box, and then we would know for sure that that was a test one if we do look at it.
Yeah, I don't have anything else to add on that one. I think we do plan to give it a little bit. I know every time you open one, it creates a new entry in our back end data. So lots of people are going to be testing it. Even just our own team is opening and closing RICS. So don't worry about it for now. But yeah, absolutely putting that test in the comment box is very, very helpful. But yeah, please explore the tool.
I'm just going to take a little pause just to see if anyone has any final burning questions or if I've missed any critical ones. Well, I do see one that I had flagged here from earlier, mentioning that British Columbia is mentioned and whether or not they use something similar to this in their province related to DV with survivors. Crystal, would you have any insight on that?
So this is a Saskatchewan initiative. We are the first province to develop something like this. I think other provinces maybe will want to do something similar in their own jurisdictions. Certainly the risk indicator checklist, we feel, because it's based on risk factors, not only in the Saskatchewan Domestic Violence Death Review, Ontario's Domestic Violence Death Review, the BC list of risk indicators, and other risk assessments used more broadly. Those risk indicators, those are relevant wherever you are. If another province was going to do something similar, they would want to create their own safety planning guide to link to relevant resources in their area. So in BC, they have that risk indicator checklist that police and connected service providers use. So a little bit of a different thing, and they have a different process with multi-sector case review teams, and the work there is a little different, but we felt it was relevant to look to their risk factors for an example of a good practice that we could build on.
Thanks, Crystal. And we are getting close to the end of our time here. I will say I've noted some of the questions, comments around RCMP in particular. It's certainly valuable for PATS to hear that information and be aware of some of the areas where more work and advocacy and awareness can be done with our RCMP across the province. And also want to thank you all for the amazing positive comments that we're receiving and all the support. Of course, that's always wonderful to hear and see. And credit to Crystal, Jess, Jen, Myrna, and those that collaborated on this project to get things off the ground. Again, I'm new, but so excited to be part of things as they roll out here. So we do want to remind you today that all of this information that was discussed, all of the tools, the PDFs, the practice guide, everything can be located at skcap.ca. That's sascap.ca. So you can head there after today. Some of you are interested in practicing and checking things out. So we encourage you to do that. There is also information on who to contact if you have more questions, if you'd like more support around accessing the tool, just want to explore and chat further on that. But please, if you do have more questions, please feel free to reach out to one of us at PATHS. In particular, I would point you to Crystal, our wonderful Dr. Giesbrecht, Crystal at PATHSSK, PATHSSK.org. And with that, we will close things today. Thank you everyone so much for all the wonderful comments, for joining us, for your excellent questions and review. And thank you to our presenters.